Hi everyone, back again today. This is Jenny with My Nurse at Home. Wanted to talk with everyone today about surgical decisions, specifically lumpectomy versus bilateral mastectomy when it comes to early stage breast cancer. There's a lot of talk about what is the best choice when it comes to the surgery, and this is really something that every patient needs to take some time and weigh the decision that is really best for themselves. So today I want to just review lumpectomy versus mastectomy, again, in the early stage of breast cancer. And I also want to just put out there as a little disclaimer, remind everyone, I'm a nurse. I support breast cancer patients and provide education services and support. My information does not in any way substitute for direction from your personal medical providers. Okay, so it's important to still get information and take their advice and listen to what they say, because every situation is unique, every single one. So lumpectomy, easy for me to say, also called breast conserving surgery, all right, followed by radiation. This is just as effective in treating early stage breast cancers as mastectomy, which is removal of the whole breast. Okay, so this is good news for those who wish to avoid a major surgery or feel that mastectomy is just not the right choice. Okay, so for early stage breast cancers, all right, some patients can choose, and most experts do not recommend bilateral mastectomy. Reasons for this include that the studies show patients who choose breast removal, mastectomy, do not live longer than those who also opt to, those who opt to have a lumpectomy plus radiation treatments. Okay. Also, bilateral mastectomy reduces only the risk of a new cancer in the breast, not a new cancer somewhere else in the body. So that's important to know. Now, a bilateral mastectomy may be recommended for those who are at very high risk of breast cancer, such as those patients who have a BRCA, BRCA gene change. So if you're positive, okay, if that gene shows that you have positive, you're a carrier for that. Some of these patients will also choose to have a preventative or prophylactic mastectomy. The risk of an average patient having a new cancer in the breast is already small. Okay, and if a new cancer does occur, it's more likely that it will appear again somewhere else in the body. Now, some patients do choose the mastectomy even though the risk is low, and because any risk of a new cancer in the breast may feel just way too much to handle. Like that's just not in, the something that they can handle. The thinking of that is just way too much. So they may want to avoid the stress of having future mammograms or future MRIs, because if both breasts are removed, neither of those tests would be ordered and done. Okay, so you definitely still need regular follow-ups, but you wouldn't need those tests, the MRI or the mammograms. Okay. Now, also the bilateral mastectomy may be chosen so that your breasts look the same for symmetry. Okay, so getting those breasts to look the same is much easier if you're having bilateral surgery, meaning both done at the same time. It's hard to get a reconstructed breast to look like a natural one. So having them both reconstructed gives patients a better chance of them looking the same. Okay. The other thing is that it's just super important to take time making your decision. Okay. I'm not saying take 6 months, because that's kind of out of the realm of time, but you need to take time to really think about what is right for you. You need to think over the medical facts that you've been given by your medical team and how you feel. All right. This is a very, again, personal decision. Your feelings matter just as much as the other factors that are in there. All right. So you want to talk it through with someone that's close to you, whether it's a partner, spouse, family, friend, or someone like me who's an oncology nurse, a prior breast navigator in 2 different healthcare systems, who advocates every day for patients and has different techniques and questions that I can ask you to help you weigh your options further. All right. I'm always available to help you walk through the process and figure out what really is helping you to make that decision. I can't decide what's best for you or what would be your decision, but I can help you to kind of walk through the process so that you can, kind of go through your own thoughts in your head. So things to ask yourself, like, can I accept the small chance of a new cancer in my healthy breast, or would I be more comfortable removing it to make sure that that risk is as small as possible? Is it important for me to keep a natural feel and look to my healthy breast, or would it be more important that my breasts match as closely as possible? How long can I take to recover? That's a big factor as well. Your recovery is going to take longer with a mastectomy than a lumpectomy, okay? Or do I need to get back to my life, getting my life as normal as possible, as quickly as possible? Do I have the information that I need to make a decision, or do I need more information in order to decide? Am I comfortable with my medical team, or do I need another opinion? Also a big factor. Make sure that you're comfortable with who's ever going to do your surgery. There are a ton of pros and cons to consider, okay? Some of the pros, such as a lower future risk of cancer, no need for MRIs or mammograms, and a better chance for both breasts to match if reconstruction is done at the same time. Some of the cons, such as surgery, much more complex than a lumpectomy. So longer recovery time, higher risk of issues like infection post-op and other issues with healing. Mastectomy, another thing to consider, is going to cause loss of feeling in the chest. Normally that does not come back. There's also scars. Those will also be permanent, okay? Also, most likely you will have more than one surgery with a mastectomy, especially when choosing reconstruction. More than likely, it's not going to be done in one surgery, okay? Lastly, it has no effect, none, on your risk of cancer anywhere else in the body, okay? So just keep in mind that I do help others just like yourself walk through this process, and we find ways to find clarity in making your decision. I know this is very difficult. Again, it's very personal. I can provide techniques as individual as you are to help you find some calm in this storm. I'm here to support you on your journey and during survivorship. Reach out on social media, via my website, or give me a call, and let's talk about your journey today. I'd love to help support you too, okay? Thanks so much for watching. My contact information is right there on the screen. Thanks so much. Have a great one.